we're going to talk money, because ultimately, not only are we clinicians, but we're businessmen as well. And what it's done is it's changed and enhanced the level of time and value time that we can spend with the patients, because it gives the information quicker, more efficiently, and just that kind of 5 minutes of taking those examinations has cut down a lot of the experimental.
And that's a benefit for the patient. The patient don't want to stay in your office for 3 hours, putting on 5 different lenses while you figure it out.
Exactly.
There's a little loss of credibility.
How profilometry and technology in general can benefit your practices. One important area is the tech is impressive to patients, and so we actually use it almost as a practice builder to enhance the whole patient experience along the way. Patients in our office absolutely love the process of being able to see on a big screen their full ocular shape so that we can explain to them. You know, if I'm putting you in a higher cost freeform or impression-driven lens, these are my evidence-based reasons for why we would ask you to go down that path. And these are the reasons why we would maybe choose a different lens design. Patients buy into the process more when they're involved, just like anything. And so as a practice builder, using the tech to be impressive in our marketing attracts patients to our clinic. We get patients that come, find out that we're one of few centers in our area, which is growing exponentially in regards to the technology kind of running through as we have more time and, you know, better education and everything is advancing. You know, at one point, corneal topography was fairly novel, and not every specialty fitter had it, you know, and look at us now. So we use it in our office as a practice builder and also just as something to kind of make sure that patients can follow along the process.
But as your practice grows, the time that you can afford to each of these patients is going to diminish. So you're going to have to find ways to become more efficient, and the eaglet is the best way I've found to get there.
It is just something to have in your practice. It's I go back to the business model again. It's a USP because, you know, I guess we're not all in the same town. We're not in the same country. So each one of you who is looking at potentially getting an ESP machine device, you will become the only person in your town, in your city, in your country, in Jesus' case, to really have that quick assessment, and it's smart.